This examination requires a physical touch or contact. Will that be okay for you? So, respect head and then face on color. Mention the front and the expansion of the ears and face. The note for the facial expression is palpation, triangle, neck, forward, and note for facial expression and palpate the
Pino, how do you assess for the face?
Okay, examine now the I inspect the external eye structure, including the eyelids, the eyelashes,
Gusto
the
matanaw na
eyebrows,
ninyo
and
or
the
do you have something
eyes.
to say to your patient
And then
to check for the symmetry of your
cornea is and
how do you assess naman the symmetry of the face?
artery of my patient. Then I am going to listen note for the color, symmetry, and the alignment. Now, next to examine the pupils, the equality of the size, like acting the light, by darkening the pupils, and then light to shine the light in each cornea. So when examining the eyes, always remember the cornea, which pupils equally rounded and reactive to light and activation.
Examine people for colleague of size reaction to light by darkening
So ensure that
the
both
using
pupils react to light equally. Next, that's for pupillary accommodation. So ask the patient to focus on an object as you bring it close to the nose. So sir, I will be asking you to focus your eyes and ears on this light as you bring it closer to the object.
and as you bring it closer to the nose.
Now, using an ophthalmoscope, check the reflex. So since we don't have the equipment right here, I explain the procedure. So ophthalmoscope is used to check the inside of the eyes, especially now. Normally we use the and shine the light of the ophthalmoscope to the pupil to just check and look for red glow and then that's the patient visual acuity with the electronics. So normally the patient will stand about 20 feet away from the chart. 20 feet away. Yes.
20 or 2?
Read the pattern as well as possible line of letters. Now cover your right eye first and then read saying after the patient
About 2 feet away as the patient
and then you cover your left eye first and your chest is now with the patient about 2 feet away, reach your side of the shoulder. Ask the patient to focus on your finger and move the patient's eye through the movement of 6 cardinal signs. Okay, so sir, I will be asking you again to focus your eyes and again in my fingers as I move the different direction of the palpate the air and my straight process. Now I am done assessing the head and neck of my patient, so I will and lastly I am going to document. Okay, now I'll be assessing the ears. So expect the external ear by doctoring for shape, size, and shapes. Palpate the ear and then that's the process. Yes, sir. Then perform an endoscopic examination for adults. Pull the auricle up and back. For the child, pull the auricle down and back. And then now since my patient here is in the color, I'll be holding his auricle out and back. And note for cerumen, edema discharges or other foreign body and check the condition of the tympanic.
we explore to perform with test
Okay, how do you perform that idea?
Pull the auricle down and back.
Perform.
Like this, forward and back.
Dili pa one and a
Okay.
Apa gamay? Apa gamay mo?
Down and back.
Ha?
Okay.
inspect and palpate the external
Up and back. with the titles we'll use a whispered voice during that hearing. So as the patient stands about 1 to 2 feet away from the patient, I will be performing 1 to 2 feet away out of his line of vision. So, and as the patient's recovery, load clear the being tested and perform the test regularly. So sir, I'll be whispering some words and you have to repeat them back to me. Now cover your right eye, right ear.
So the purpose of this examination is to identify which volunteers
Now cover your left ear.
have any questions about
Our
So now,
Okay.
and today let's present to the mouth. So first,
Okay, now use the tuning fork to perform the Weaver's test and the Ryan's test. Assuming this is
so
correct.
now we will go into
Right. Now I'll be performing the Weaver's test first. So sir, I'll be putting this fork in front of your head, above your head, and tell me if you hear the sound or the sound equally in your both ear, and or if which side of the ear you hear the sound most.
the facial distribution of the hair and take note for the facial expression. Balik-balik ang ganyan. Okay. So ma'am, I'm going to check.
Sige, Miss Pino, what do you
Now I'm
assess
going to
during
perform
the
the Ryan's
scope?
test. So, sir, I will place it this tuning fork. I open or your master doctor and tell me when the sound disappears or the vibration disappears.
So now, I'm
Now, do you
going
hear the
to
sound?
Sige, proceed.
proceed to the checking and inspecting the external anesthesia of the patient, which includes the eyelashes, the eyelids, the eyebrows, and the ears. And also I'm going to observe the cornea, the conjunctiva, and the sclera, and
Okay, now I'll be assessing the nose. So, inspect and palpate the
Sige, para
external nose.
magbasan, magbasan, right? How do you assess the face as a metric?
Then, palpate light paper goes over the frontal and
Aside
abdomen
from
by
inspecting,
side.
you have something to do for your patient about this metric.
Pen light.
Kaganda, nanay ko pa ni mo yung karton. Kaganda ka isa. Tapos mayroon yung
And now,
patient.
occlude the nose
Aside sa
externally,
mga
but and cover the other nose and repeat for the other side. Now, sir, can you please cover your other nose ring and
It's
then
for
breathe
your
in
cranial nerves number
and
7.
breathe out. And the other nose. Breathe in,
facial expression.
breathe out. Now, inspect the internal nose ring
facial expression.
using a nasal
Since nagtag na
as
ako
the
sa mga
otoscope with a
side,
nasal
place the
symmetrical yung face.
laid at the side of the
But if
tongue
they,
and
wala din na siya nipon sa ilaw. So,
inspect the
Now I'll be assessing
Inspect the
the
tongue
now.
by sticking out
it's your mouth.
I'll take the temporal mandibular device by placing your index finger over the front of
Wala
the
na
ear
expression. Hindi mo
and
siya ipasmile. Hindi mo na siya
ask the patient to open it
for muscle tone and
proceed.
tenderness.
So now I'm going to
Now can you please open your mouth? Open
proceed to, I'm going to use a knife
Remove the glove.
to
and then
check the
perform
internal
hand
size
hygiene
and
and wear
give
glasses.
your reaction to the light in a dark room.
Sige, man ako nakapal. Sige. What do you check man sa otoscope?
Assessing the posterior neck, so palpate the
So
front
now
the
it can
posterior
be
tongue,
sa nose or
the neck,
ear.
circulation
And
and
check pa
conversion.
sa nung kasama din mo kita na abnormalities inside the nose. Aside sa discharges, but
Mga dried mucus eh.
aside right
So thank you ma'am.
Mga cancer. Yung silyo.
Inspect and palpate the front of and behind
I'm going to
the chin
use
and the anterior triangle of the anterior cervical.
tulad si pero magsabi na
So now I'm going to use a standard chart. I want you ma'am to
you cannot assess the sinusitis is the sinusitis here on the back. Hindi mo na naman check ano is na
read
kind of
the
patient.
smallest letter as
of the school?
Inspect and palpate the left and the right
What do you
carotid
assess? What
arteries.
grade would
This is stethoscope.
Because you know you, sir. Okay, now inspect the lips and oral mucosa, the hard and soft palate, and the gingival teeth and the salivary glands. By asking the patient to open the mouth wide using the tongue blade and the pen light.
Thank you, Mami. Next is I'm going to do the 6 cardinal questions.
Inspect and palpate the trachea.
Lips.
Sige, Pino, how do you
Now,
assess
open
the
your mouth
trachea?
wide.
Where does the trachea start
Wide,
and end?
please. Open it up, yes.
Where? Where does it start and end? If mag-assess mo,
Then
where do you
inspect the
inspect?
tongue.
So
So
now I'm going
ask the
to
patient to
point
stick out the tongue and place the tongue blade at the side of the tongue while the patient pushes the tongue at the left hand side with the tongue.
I'm going to
Please,
palpate
can you
the ear
stick out your
and
tongue?
then the mastoid
And
process.
then can you move your
Inspect and
tongue
palpate the
to the opposite
supraclavicular area.
tongue blade?
Inspect the ability of the patient to move his leg.
So now I'm going
Please
to
move your shins and chest. Now inspect the uvula. They ask you to say left shoulder while sticking out the tongue. Can you say ah while sticking out the tongue? Here, no, one finger. Right, stick out your tongue. Ah.
panic member.
More.
Stick the ear to the left shoulder. And then keep head up as fast as possible. And perform hand hygiene and document the findings of the assessment.
Look at it. Palpate the pansa, the tongue, for muscle tone and tenderness.
I'm going to
How do you
use a
palpate?
whisper
Using
voice.
counter, but my glove is already sterile, sir. It's
I want you
contaminated.
to